Painful periods isn't normal, although it's common, and that could be from your lifestyle. It could be from stress. So there's so many areas in your life that you can work on to improve your quality of life.
Tanya, a lot of people come in and sometimes they come in knowing that they have a short menstrual cycle or a regular menstrual cycle, a heavy menstrual cycle, a delayed ovulation with a long menstrual cycle. But I think we need to start off with what is a normal menstrual cycle?
So the textbook normal menstrual cycle is when you have 28 plus or minus 3 days between periods. So you bleed, and that could be a nice, we say in traditional Chinese medicine, a nice bleed would be, 5 days, maybe 3 days, moderately heavy, changing your pads 3 times a day to 4 times through the day, and then one overnight pad without leaking. If you're using pads, if you're using tampons, they're the regular ones. So it's not anything excessive. If you're using a cup, it would be like less than 90 mil. Each cup, like little menstrual cups, are like 30 mil. Be less than 90 mil. More than 120 mil would be like a little bit excessive for the whole flow. That might cause iron deficiency. So, and then it lasts for like 3 days, kind of in that pattern of changing your pads just a few times per day and not leaking at night. And then going on to like a lighter, like a lining thickness of menstruation for day 4 and 5. So, and the blood, the flow is nice and bright and red, and you're not seeing huge clots, right? So it's like a nice, clean flow.
I love that you added that in because I was just going to jump in and say it's not just about the volume, it's also about the quality of the bleed. How viscous is it? How watery is it? And all of that is we look at it in terms of the TCM mindset, and we define it and it means certain things. So if you want that kind of an assessment, please call us at aliveholistichealthclinic.ca and we can get you on your way because you might be curious, like, where am I at? Like, is it normal? How am I menstruating? Even though I have that 28-day cycle, how is the quality of my blood? And we can assess that. And then there are things that we can do through acupuncture, through lifestyle changes, whether it's diet, sleep, movement, and Chinese herbal medicine. And with what Dr. Tanya Wild does is like utilizing other kinds of supplementation that can also impact the quality of the menstrual cycle.
Yeah, we're trying to improve your egg quality through improved circulation with acupuncture, Chinese herbal medicine, supplementation, lifestyle medicine, not just to improve your egg quality for getting pregnant, but to have a healthy quality of life with your menstrual cycles. Painful periods isn't normal, although it's common, and that could be from your lifestyle. It could be from stress. So there's so many areas in your life that you can work on to improve your quality of life. And then, the period shows up every month. Well, if it's regular, and if it's not, we want to fix that because that can impact the hormones in your brain. Like if you're delayed in your ovulation, you might think, oh, yay, no period. This is so easy. But is that ideal for your bones and your heart and your muscles and your brain? No, we want regular menstrual cycles because we want the estrogen and the progesterone. Those are happy hormones, right?
So I love this. And you know what? I was just thinking, like, let's do something really cool and crazy. So if you like this episode and you want to learn more, like, why don't we give you 3 tips that we're not even going to talk about in our episode today? And you can just contact us at clinic@aliveholistichealth.ca or just go onto our website at aliveholistichealthclinic.ca and we will send you a little PDF version of 3 top tips coming from a TCM point of view to help with your menstrual cycle.
If you're finding that it is painful, for example, or irregular, right? Like, or just seems like outside of the norm of what we just said was normal.
Yeah, like just quick little tidbit tips.
Mhm.
And, I'll show you like an acupressure point. We can do like add one little herb in or something, something, a food thing, just
Mhm.
something very simple,
Yeah.
but it'll be a surprise. So, just reach out to us.
We'll make it very effective and helpful for you. So going back to regular, people are always often concerned, oh no, well, my periods aren't regular. And then we don't want to stress them out, but we can really do such small little things to make a big impact. And regular is one kind of window into like healthy vitality. So if you have a regular cycle and a non painful cycle with lots of healthy, bright, not lots, but like a normal amount of bright red blood, you're doing really well. Now, if it seems irregular, let's say your periods are delayed, do you want to talk to that piece? So, like a delayed period, does that mean that my periods are delayed or it's my ovulation that's delayed? I think that's where people often get confused.
Right. And so often, well, I mean, unless you're PCOS and sometimes you just don't actually have ovulation. But let's tackle the part where, you know what, you just have a delayed ovulation. What's happening there? In Chinese medicine, we look at the energy of the kidney, which rules the reproductive organs. So, anatomically speaking, the kidneys are really close to the reproductive organs. But, we're coming from a system of medicine that's been around for 3,000 years plus. So they're going to speak a little bit more philosophically. And, we're talking about the energy of the kidney, the reproductive essence. And as we age, there's a decline of this kidney essence, this jing. And what happens is when it becomes more delayed, there's a possibility that that yang, the action of the energy. So, we talk about yin and yang. You're probably familiar with the terminologies by now in this day and age. But like, what does that mean exactly? So the yang energy, which is that vibrant male action, motivated force energy, that can go on the decline. I mean, like, listen, when I was in my 20s, I could pull off an all-nighter, no problem. Now, no way, man. It's not happening. So kind of like the reproductive essence, same thing. It's working harder. It's slowing down. It may take a little longer. And when it's pathological, that means we can probably help it so that the ovulation can become more efficient and more effective so that we can shorten that menstrual cycle so that when you ovulate, it'll be more at an effective, efficient time.
Speaking of not pulling an all-nighter, that would be one of the treatments. We would be really working on your sleep. Not having a period and not ovulating for a while may be impacting your ability to sleep. So you'd want to really work on that piece because that can actually play into the hormonal cascade. So that HPA axis. And maybe it's your really high stress in your life right now, and the lack of sleep is then now affecting your menstrual cycles. And if you work on the sleep piece through stress management tools like, a healthy amount of exercise, not over exercising, acupuncture, eating the right nutritious foods, not like fasting all the time. Because if you have a high stress, some people overeat and some people undereat. So,
Yes.
and right. So
Yes.
then it could kind of all play into that. Now, it could be that you're in this perimenopausal state or the kidney yin deficiency state, right? Which is right, or would it be a yang excess?
Yeah,
What's the
so it would be the deficiency of yang that causes more long
okay,
cycles,
okay,
typically.
and
Or
then
not
that would
enough
be like an
blood, not enough
example.
essence, right? That
Right,
can do that.
right. So even iron deficiency
Yes.
actually can do that as well. So like in an iron deficient state, you can have a delayed period. Sometimes people are confused because they're thinking, okay, well, if I'm iron deficient, wouldn't it be because of my heavy periods? Well, heavy periods can then cause iron deficiency. And then what you're saying, they don't have that essence or that blood, that iron the body's protective. It's smart. It's like, okay, I'm not going to menstruate. So quite fascinating how the body is so magical and mysterious all at the same time.
And I
You
love
know?
how you just gathered in and brought in the Western piece because that is exactly true, right? Like there's the yin and yang, but then there's the tangible, like, oh, how's the blood and how's the ferritin? All those
Mhm.
tangible things that we can test.
Yes.
So now let's move on to shortened menstrual cycle, right? Because the path to regulation will be the same, like looking at the lifestyle, what you just mentioned, the lifestyle medicine,
Right.
which includes the acupuncture, the change of diet, a healthy diet, and the regular sleep. But it can impact and create shortened menstrual cycles, so we can help to balance it and regulate it through these kinds of modes.
If it's a woman with regular, like shortened menstrual cycles because of polycystic ovary syndrome. You might see periods less than 21 days apart and really heavy periods. We talked about kind of that estrogen dominant state, which isn't really an actual condition. It's more that your body is manufacturing more estrogen from attempting to release an egg, and then you don't actually release an egg, so you don't have the complementary progesterone, and then you're making a thicker uterus lining, and then you're having really short, heavy periods. That's a state where I've seen that with women when they correct the insulin resistance and improve their nutrition. Perhaps they have weight to lose, maybe they don't, but they're working on their lifestyle, maybe using certain supplements to help with egg quality specific to their condition of PCOS. Then they start to release eggs and they're ovulating. Now in a condition where it's like they're 21 days apart and it's not because of PCOS, it could be, as you mentioned, that kind of yin deficient state where they're kind of moving into perimenopause, right? So they're actually their cycles are starting to shorten or vary by plus or minus 7 days. So if they're having a 21-day menstrual cycle, they're releasing eggs quicker every month, and their follicular phase got shortened. So with something that's really important, I would love to just reiterate, and I've talked about this and we've talked about this in previous episodes, is if your periods are irregular, how do you even know when to predict that they're going to show up? And it's hard because although I use this as a factor or as an observation, it doesn't always work because women with perimenopause might not see this. But it's the egg white cervical mucus. So pay attention to your wiping when you're going to the bathroom. If you feel a slippery wipe, like let's say you're going to the bathroom pee and you wipe after and you feel a slippery wipe because you might not see the egg white cervical mucus. It's like when you crack open an egg, that goopy white part before you cook it, that you might see it, feel it, or notice it in the toilet. That is a sign your estrogen's on the rise. And when you see a lot of that or feel a lot of it when you're wiping, it usually means the next day you might not see anything. It's like a dry wipe. That's the ovulation day. And that's the next 2 weeks is usually not variable for women. We call that the luteal phase. So for any given woman, her luteal phase is always the same. So for example, this might be too much information, but mine is always 12 days. So I measured this back in my fertility days. So if I see it and then it's gone, I know I'm going to get my period 12 days later. So in a phase of irregular menstrual cycling, I'll at least know when to predict my menstrual cycle. It doesn't change.
Yeah, and
And
that's
that's
typically
helpful.
for everyone, right? And it may
Yeah.
not be 12, but it may be
No.
14, 13, 14, 15,
Hmm.
depending on the person. But,
Yeah.
the bell curve figure will say the mean is like the 14 days after ovulation. Now, speaking to all of this, okay, we're talking about regulating the menstrual cycle. And what is so cool and what I've seen year over year after 31 years, close to 31 years of practice, it's so cool to witness the regulation of cycles through acupuncture. And before we went on, you said, gosh, Mary, like people will always ask, well, when should I start acupuncture or how often should I do it? Well, here's the thing. When we look at follicular genesis, no matter if you're trying to conceive or if you're in perimenopause, we really want to have as much regularity as possible because, as you say, when we have better egg health, it actually makes a better, healthier you overall. And so, when to start is like yesterday, today, anytime you can, because the development of an egg ideally is like, from that germ cell stage to that ovulating egg is about 90 to 120 days. So, really, we want to be consistent with our treatments to help kind of nudge it along, or what I call juicing them up so that they can develop into juicy little eggs like grapes.
So I think one of the misconceptions is that based on what people are reading, let's say on the internet or in the literature, they're testing IVF procedures with acupuncture, just like before and after a transfer, or, go for acupuncture, you're told, around ovulation. Is that accurate?
So that's a really great point because don't forget, these things are coming off of research, and research is research for research. And typically what makes the most money, it's an IVF cycle, right? So the interest is strictly at the IVF cycle. And the problem with doing the pre and post embryo transfer treatment has nothing to do with the eggs. It's about the uterine lining in that moment, right before. So we say as acupuncturists, is that enough? Well, probably not enough. And we've done an episode where we interviewed Dr. Lee Hollander Rubin. So you can go back, and I don't actually remember the number right now, but just scroll down and find that, because we address this. It's like, yeah, likely we want more than one session. And again, as I mentioned, if we're looking at egg quality health, then you want to be consistent. And it's like if you plant a seed in soil, you don't just water it once and expect it to grow. You have to be consistent. You water it every day. We're not saying do acupuncture every day, but and what that may look like will be different. It could be once a week. It could be twice a week. And if you do remotely, it's like, oh, well, maybe we have to do some electrostimulation through these transcutaneous acupoint stimulation machines. You know, there's just so many different ways to go about it. But this is not medical device, not advice. This is not medical advice. So what you need to do is actually reach out to us at aliveholistichealth.ca, speak to one of our team members, and see what path you may need to follow that will optimize your transition, whether it is going through perimenopause or trying to conceive or postpartum health, like wherever you are, like we can help you. And during the pregnancies, prenatal period, we use acupuncture then too. So really, to me, it's like a transition of life.